Aloha! We want to thank all of you for joining us today. I'm Dr. Taketa-Wong. My mission is to heal the sick, not just give them pills to take for the rest of their lives. And as a naturopathic doctor, I can write prescriptions for drugs, but I'd rather write them for herbs and for healing foods. And as a Chinese medicine expert, I can employ a whole different approach to health that complements our Western system. And as a healer, my mission is to educate and empower as many people as I possibly can about how to become healthier and happier. Healthy people, happy world. My specialty is the medical treatment of autism, ADHD, and other special needs. And I also treat some of the toughest adult conditions. We don't take new patients without a phone consultation first. So please contact our office if you have any questions for me. We do a free 30-minute phone consultation. And the purpose of that is to see your main concerns and coming up with a plan to see how we can help you the most. So at today's event, I'm very pleased to introduce you to Carrie Curtis. She is a licensed massage therapist who uses massage as medicine. And we typically think of massage as helping with tight or sore muscles, which it definitely does, but it is a powerful and very valid medical treatment for many other conditions. Massage can help to remove toxins from the body, but can also treat other conditions like frozen shoulder, fatigue, anxiety, and even autism. So I'm going to introduce Carrie to you. Carrie Curtis is the owner of Hamo'ea Healing Arts. She has been a licensed massage therapist since 1998 and has studied Lomi Lomi, which is the art of Native Hawaiian massage, with nearly a dozen Native Hawaiian masters during that time. She's traveled the world teaching Lomi Lomi workshops as well as offering retreats in Hawaii. She has trained and practiced as a birth doula and teaches pregnancy massage. Her website is hamoea.com. That's HAMOEA.com. And we also have a link to her website in the post for this video. So Carrie, welcome. I'm really, really happy to have you joining us as a guest on our show today. So
yeah, I'm excited to be here and share this information with your patients and clients and everybody who's watching. A little bit about me. I've been doing massage on anybody who would let me since I was about 4 years old. My dad was in the military, and so we traveled a lot, and we would have these block parties, and I would go around and do all the adults' heads or shoulders or feet, or I did back walking from the time I was in like preschool. And just loved touch of all kinds. Anything I could get my anybody I could get my hands on, I would get my hands on. I became a professional massage therapist in the late 90s, and I've been practicing and teaching for over 25 years. And yet a lot of my focus is on the traditional Hawaiian massage. I have trained with 11 different masters over the last 25 years. I also have a specialty in pregnancy massage. And I'm also the mother of an autistic child. So I also have a focus on using it to help kids with autism, ADHD, other neurodivergent populations, and special needs conditions. A lot of times people think of massage as just a luxury, something you do when you're on vacation, or, it's something that you treat yourself. But regular massage, either professionally or learning how to do it within your own family, can help in a number of different ways. You boost the immune system, makes you more resistant to infection. You're reducing stress hormones, your sleep is improved. So those things on their own can help support the immune system. You're also increasing the production of oxytocin, dopamine, and serotonin, which are those happy, feel-good hormones and chemicals in the body, and they kind of offset the balance if you have too much cortisol or too many stress hormones in your body. Having a flood of the good juice also helps kind of balance your body out in that way. And a lot of times for kids who are on the spectrum, they do have a deficiency, or sometimes not as much oxytocin production. So having natural ways to boost and stimulate that can be really helpful. It also, like she said, mentioned the frozen shoulder or injuries, both chronic, things that are ongoing, like all the itises, any kind of inflammation in the body, arthritis, any old injuries that plague you that can sometimes throw the body off. You might not think about, your shoulder being out of alignment or tight might affect your gait, might affect how you carry things, might affect how you shift your weight and carry yourself. So it could have kind of a trickle effect throughout the body. So massage can be a great way to treat all. Either get yourself a professional massage, or there's all sorts of great ways you can do it yourself too. You have things like a therapy ball. This you can put up against a wall if you've got tight spots. You can use it in the shoulders, the low back, the hips. People with sciatica, this is a miracle. You just put it up against the wall and roll it across your butt, and it will loosen up the piriformis, which is the muscle that usually pinches and squeezes to give you that sciatica. Things like a S-hook. These are great for those trigger points, those knots that you find a lot of times in the shoulders, low back. If you're a runner, somebody who does a lot of sports, this is like a rolling pin style. You can do this on your own legs, or have a friend or family member help you with it. It's easier on yourself on the legs because you need both hands, but you can have somebody roll it on your shoulders, on your arms. If you're somebody who types all day, really getting into your forearms can help avoid things like carpal tunnel surgery or just the tendonitis and pain that comes from those, repetitive activities. Also, silicone cups. These are great. You can use these on yourself. You just put it on areas that are sore or tight, and it actually changes the structure of the fascia, the tissue. It turns it from like a very tight, interwoven, locked tissue into a gel, more fluid, kind of substance that you can move around, and it will relieve all the congestion. It brings blood to the surface. It changes the tissue so it gets rid of those knots, so you don't have to press and rub them. You can just put this on for 5 to 10 minutes and it will start to alleviate some of that. It also helps speed up healing after surgery. There's all kinds of tools you can use for yourself. Not everybody has the budget to do, a full-on in-home massage or the time, but there's a lot of techniques that you can learn at home. Doing it within the family can also help you bond with your kids, help them learn about appropriate touch and boundaries. Or if you're caring for somebody who's elderly or have somebody in your family who has like a really demanding physical profession with back pain or hip pain or knee pain, just learning a few basic techniques can help them avoid things like surgery and physical therapy and all the other interventions that you sometimes have to get when your muscles are pulling. Way to care for elderly family members. Touch is so important. It should be in the hierarchy of needs with food and shelter. It's right up there. We need touch in our lives. And for couples, I also do private training for couples and for families in their own home. So if you want to learn how to work on your kids or want to teach your kids how to work on you, or for couples who want to work on each other, it's a great way to kind of maintain the longevity and closeness in the relationship by sharing that, making time and sharing touch on a regular basis. So I do all of those things. I teach, I offer private sessions. I have most of my classes, a lot of them are for professional body workers and massage therapists, but I have a number of classes and private training that are open to anybody who wants to learn. I'm doing a cupping class in December and also pregnancy massage class, which is beautiful work. It's all side lying. Anybody who wants to learn can learn. You don't have to be a massage therapist for those shorter classes that I teach. And I also have a series called Malama Your Ohana, where you can learn how to work with elderly family members or kids who are on the spectrum, or just your partner can break down the sections of the body. So people who have like chronic headaches or neck and shoulder pain, learn that section of the body. If your issue is more like lower back and hips, I have a section for that. So it's a really great way to connect, to all stay healthy, and to reduce the stress hormones that kind of build up from life in general. Yeah. And my contact info is in the slides. If anybody, you want to learn how to do massage, if you want to receive a massage, Anybody who mentions Dr. Taketa-Wong or this presentation gets $20 off your first session, whether you want a private massage or you want to learn how to work on your own family members. I can also do training over Zoom especially for people who have autistic kids, like they might not be as into having a stranger come into your house and touch you, but you can learn without somebody in the room, maybe just in your ears telling you what to do. I've seen a lot of success with my own daughter. She's been treated by Dr. Taketa-Wong since she was 4. And there's such a big difference from looking at the whole person versus just assuming all autistic children are the same and the only solution is ABA, right? So they never look at labs. They never look at what's going on with them psychologically, any underlying imbalances. And we've had a lot of success with supplementation, changing the diet, checking which foods were triggering different kinds of emotional reactions in her. And the pediatricians never even thought of any of it. They've never asked for a blood test or checked anything other than like her physical traits when she walks in the door. It's like weight, blood pressure, do you need a vaccine?
Yeah.
And that's it. So they're never really looking at the underlying causes, and it's so important. And the touch component has been crucial too. Like my husband and I are both massage therapists, so we've always had a lot of touch with her and had a lot of closeness, lots of snuggling. And even to this day, she's 12 now and she'll still come up and snuggle with you, and she's not afraid to do it. But you gave me the Qigong book for kids, and she was really little, and it had a great sequence that you can use on kids who are autistic to help calm them. There's a really good article, I'm going to send a link, NPR has right now about using touch to calm children. And they talk about both physical benefits and emotional benefits and the different styles and all these different cultures around the world, how they have all of these different touch. They have different names for the same type of touch. It's that like really gentle kind of petting, almost like the way animals groom each other, right? Like where you see monkeys like picking lice off each other. It's really like the relaxing, or you go to the hairdresser and you just let them wash your hair. And just that simple, gentle scalp massage can like change your day. So adding that into your own family, into your own life and your own mix can make a big difference in how you present yourself to the world. If you're in pain all the time, it's going to be really difficult to function both mentally, physically, emotionally. So just getting the pain out of the way can be life-changing. And if you learn how to do it at home, even better, right? Or have somebody come to you and you just roll out of the massage table into your robe or into your bed and rest.
Yeah. And so
for all of that.
And so you brought up a lot of good points. And so as a child too, I grew up, my dad taught me how to massage, and as a family would massage each other and things like that. And I think just people realizing that massage can be powerful in so many ways, right? It's not just a luxury thing. But I have frozen shoulder. I had frozen shoulder, and Carrie actually treated me as a massage therapist, and I will tell you, I saw more improvement with one massage with her with my frozen shoulder than I did in 3 months of physical therapy. And I don't want to, knock physical therapy. I think that it is important. It's a very helpful tool. I refer patients for physical therapy, but there was a missing piece in there, that the fascia was really tight. So the fascia is like this connective tissue, and it was just really, really tight, and I kept on trying to do exercises and things like that. And because the fascia was so tight, it was just really difficult to be able to move my shoulder appropriately. And so when Carrie was working on it, doing cupping and things like that, then it actually really loosened up that fascia, and then I was able to move my shoulder now, and I will tell you, my shoulder is almost completely back to normal now, just after several sessions of massage with Carrie. And so I've had a lot of massage over the years from different therapists, and I will tell you, Carrie's honestly like one of the best that I've ever, had work on me. And so she's really, really good and knows her stuff. And so I think that's one of the points that I really wanted to drive home, was that massage is an incredibly valid medical treatment for so many different conditions. And I had mentioned earlier about detoxification, because many individuals, children with autism, but there's almost everybody. We live in this toxic world where there's so many toxins. And I've treated a number of patients. I had many patients who are affected, unfortunately, by the fuel leak that was on Red Hill, where there was jet fuel that leaked into the water. And unfortunately, I had a lot of patients that were either they came to me after that incident, or I was already treating them, and we saw, unfortunately, a lot of their symptoms getting worse during that time. Everything from children with autism to people having headaches, fatigue, skin rashes, urinary tract infections, all kinds of issues. And massage is a way to help to support the detoxification.
Yeah, especially the gut. Like, I think we're starting to understand more now about how important our microbiome is and how much of our processes happen in the gut. So for a lot of times with kids with autism, or even people with other conditions, the motility in the gut is really slow, and so absorbing all of those toxins, and they stay in the system longer than they should. So just really simple abdominal massage, using things like warm packs, or vinegar or castor oil packs on the abdomen, and then doing massage can help clear all of that. And also really light, like lymphatic massage. People who are recovering from cancer and chemotherapy and all those kinds of things are super, super toxic. So you help stimulate the lymphatic system, you help stimulate in the abdomen, the liver, and all of that, to help really push and move all of that through, so that it doesn't hang out in the body any longer than it needs to. But yeah, if everything slows down and everything gets stagnant, you're sort of like a puddle of
Right.
a dirty puddle that needs to be cleaned out and flushed out. And yeah, massage, manually removing all of that can be really, really helpful. And I definitely think physical therapy has a place, for sure. And if you do have to get physical therapy, try to find one that does. A lot of times they do have a manual component too, but it's usually just like a couple minutes of cupping or some gua sha, or they'll use tools on you. Find somebody who has that focus, so that you make sure that you get that before all of the exercises and adjustments and things they do, because they're really good at restoring function. But if there is something pulling you out of alignment, or the tissues are too tight, or the fascia is all locked up, and they're not addressing that, then you're just like powering through really painful exercises that aren't going to help you. So putting all of those pieces together can be really, really helpful at speeding up the recovery process and making it more pleasurable at the same time. Because sometimes physical therapy is good, but sometimes it's like torture if there is no recognition that the tissues need to be like softened first before you work them really hard.
Yeah, no, definitely. And also, just I wanted to remind our viewers that that again, you can learn more about Carrie. We have the link in the post to her website, hamoea.com. Also, if you have any questions for me, or if you'd like to talk with me, many people do visit our website after viewing a video or two, and then some do become patients, and myself. We also have a couple of other doctors at our practice, Dr. Williams and Dr. Anderson. So again, you're welcome to schedule a no-charge phone consultation with me to review your health concerns and see how we can help you the most. All the contact information is on our Facebook page. And also wanted to remind our viewers that we do have an online supplement store on our website at drtaketa-wong.com. All our prices are very competitive, and 100% of the proceeds go to helping children with special needs with their medical treatment when there is more financial need. And we also do have several of the families who are benefiting from the Family Support Fund, from the proceeds from our supplement store. Several of them have posted some thank yous and some testimonials, or just talking about how the proceeds from the store have been able to make such a big difference for them. It's really enabled some of these families that otherwise really wouldn't be able to access care at all. It's really enabled them to be able to get care with us. And so we thank all of you who are purchasing from our online supplement store, and we have a link in the post with this video.
Yeah. So, and I will say one last little push in your direction of like all of the tests that she orders and recommendations that she makes. If you're finding a hard time, like some of it is out of pocket, but a lot of them are basic blood tests that your pediatrician would order for you. And that's in our relationship over time. We've also had her just send everything that we need to do to the pediatrician. And then when they request it, insurance covers it. And then you benefit from her knowledge and experience and all of her supplements, but you can get a lot of your labs covered. And that's sometimes where the biggest chunk of that expense can be. So pick her brain if you can. There's so much in there.
and also, I mean, with some insurances, we need to request labs from the primary care doctors to have it covered by insurance. With other insurances, typically the HMSA or UHA or HMAA, the HMO or the PPO plans, with those insurances, often I can just order the labs outright, and they're just directly covered. So depending on what insurance people have, then a lot of insurances will cover labs that I can just order directly, and I don't even have to request them from the pediatrician.
And great.
Yeah.
Even better.
and so in terms of kind of looping back around to the treatment for autism, as you mentioned, a lot of these children have deficiencies in oxytocin, and oxytocin, you had mentioned, is a feel-good hormone. And oxytocin is also really important for understanding body language, tone of voice, social cues, and things like that. And some of our children with autism have difficulty being able to understand those or pick up on those. And so we've seen that with things to increase oxytocin, and massage is one of those, that will often help many of the children with autism to feel more calm and relaxed and happy, but it will also often help them with that social piece, with understanding the social cues and tone of voice and facial expressions and body language and things like normal social interaction. So so that's another piece that's really important. And the last part I wanted to just mention, that in terms of with treating the medical part of autism, then we know from, there's a lot of research finding that many of our children have difficulties with different kinds of things going on in their body, their immune system, with their brain, the neurological system, with the gut. And as we identify and test and find out, okay, what's going on for this child? Like, why are they having, for example, all this anxiety or these obsessive compulsive behaviors, or maybe they're aggressive, or they're hitting their head, or they're self-injurious. And for many children with autism, it can be because they don't feel good. They might have headaches, they might have pain in their gut or in their stomach, and some of them can't tell us, my tummy hurts, my head hurts, or things like that. And so as we address and figure out these underlying things, then many of the children, their behavior will start to improve. They'll be happier. And some children with autism have difficulty with language, right? And some of them have severe deficiencies of certain nutrients. And as we address and treat those, then we can see those things improving. So
definitely. Yeah. We saw that with her for sure. She couldn't hold a conversation until she was like 5, and now she's like a brilliant, prolific writer.
Yeah, she's so amazing.
Vocabulary. I'm like, okay. Somebody who would just repeat back everything you said like a parrot for 4 years is now like coming up with words I don't even know where she learned.
Yeah.
Like, so eloquent, and I really feel like a lot of that support came from finding those things that were those missing pieces, and then filling in those gaps. So
Yeah,
thank you.
yeah, and it's great to just see how she's been able to improve. And I think a big part of that has been the massage too, because that's such a critically important piece for children with autism. And then many of them have sensory issues where they're over or undersensitive to certain sounds or textures or taste or touch. And massage, regular massage, lomi lomi, and then also you had mentioned the qigong massage. They typically teach parents to do the Qigong massage on their children. It's a massage based on Chinese medicine that parents can do at home on their children. And oftentimes, the massage will really help with those sensory issues, help to calm down a lot of that over or under sensitivity, smells, taste, textures, touch. And that will really help them to be able to be more functional and less anxious and less worried, and just being able to function better in the world. So,
And learning what your child responds to too is it, because a lot of times kids with autism are, almost opposite. Like something might feel really good to you, some really light touch, and it would be like cringy to them, or they might need like really strong compression, like a hug. They'll ask to be hugged so tight that you think you're gonna like break their little ribs, right? They need that kind of pressure. So really navigating and finding what your child responds to best, and then giving that to them, and you'll see so much difference when you find out what it is that calms them and soothes them, and then give them that.
yeah, so. Okay, well, I just want to thank all of our viewers for joining us. And just as a reminder, as a special gift, Carrie is, again, offering any viewers of this video $20 off their first massage or private training courses with her. So just mention that you saw her video with me, Dr. Taketa-Wong, when you contact her. I trust our discussion about the benefits of medical massage has been useful for you. And again, you're welcome to talk with me personally about any health concerns that you have, so that you too can feel empowered with your health. And I think that's the whole focus of holistic healers, is really just trying to help empower people with their health. So again, if you want a Facebook page, you can also, again, contact Carrie through her website, hamoea.com. And please also remember to visit our online supplement store, which is on our website, drtaketa-wong.com. Our prices are very competitive, and all the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. So mahalo for joining, and we look forward to seeing you again in 2 weeks. Thank you.
Aloha.